Certain types of bacteria adhere to the surface of the teeth and form a film or plaque which must be removed by regular brushing at least twice daily. If a person is constantly snacking so that the sugar level in the mouth is high, plaque forms more rapidly. If dental hygiene is poor and plaque builds up, it prevents saliva reaching the surface of the teeth, leading to tooth decay. Bacteria in the plaque convert sugars from foods into acids, which dissolve the surface of tooth enamel, and minerals leach out. The dark spot visible here is dental decay at an early stage. Acids have dissolved the dental surface. While the decay is confined to the enamel, it can be stopped or reversed by improved dental hygiene, additional fluoride treatment, and better eating and drinking habits. Enamel dissolves rather slowly, but when the decay has eaten through the enamel to the dentine, the decay progresses more rapidly. At this stage, a dentist must remove the decayed tissue and fill the tooth. When tooth decay approaches the pulp and the tooth becomes infected, inflammation results, which leads to pressure and toothache. Root damage is a growing problem among the elderly. The gums may shrink, leaving part of the root exposed and unprotected by the mucous membrane. This becomes an ideal site for plaque. The unprotected root is highly susceptible to decay, and additional fluoride treatment is absolutely necessary in order to hinder decay of the dental root. The teeth are rooted in the jawbone, where they're fixed by narrow threads of connective tissue. Healthy gums tightly surround the tooth like a snug collar and are pale pink in color. Gingivitis, or inflammation of the gums, is caused by the body's immune reaction to the bacteria and plaque on the dental surface. The bacteria are thus an irritant without entering the connective tissue itself. The gums become red and swollen and bleed easily. The inflammation disappears if oral hygiene is improved. Persistent gingivitis often leads to more serious periodontal diseases. The inflamed gum tissue can become separated from the tooth, and the inflammation spreads to the periodontal fibers. This leads to damage to the periodontal fibers and the jawbone, and the teeth gradually loosen. Smoking triples the risk of periodontal inflammation, although the symptoms are generally less severe. Gingivitis often causes little or no discomfort, and thus diagnosis is often delayed. It's vital to prevent the problem through good oral hygiene before it takes hold. When the environment of the mouth is in equilibrium, the flow of minerals out of the surface of the teeth and back into it is equal. Saliva maintains the correct pH balance, but if a person drinks an acid drink, the acidity rises and minerals leach out of the teeth. Enamel erosion takes place when acids eat away at the surface of the tooth, eroding the enamel. Acids remove minerals from the enamel, and they cannot be reabsorbed if the environment of the mouth remains acid. If an acid drink is drunk every 10 to 15 minutes, for instance, the saliva can never reduce the pH level of the mouth to a neutral level. The enamel grows thinner, and the teeth become more sensitive to heat and cold. It's advisable to limit consumption of acidic drinks to certain times of the day or of the week in order to prevent enamel erosion. Water is the best drink.